I'll get back to a few of the experiences, and we'll dive right back in if that's okay.
And so, if you don't mind, can we start over, because I think a lot of us were not in the room that you were presenting in.
Sure, absolutely. That's completely fine.
Thank you so much.
Yeah, of course. So good morning again, everyone. My name is Jason Gillette. I am with Guild Health Group. I wanted to say thank you to everyone for having me here to speak about community engagement and some of the lessons learned that I've had over the years. Our goal for today, again, is to talk about exchanging connection for change and what does that look like, and kind of breaking down that method using a model that I've worked on, and it's been helpful for me. And I guess it's one of those evidence-informed type of approaches. So I look forward to kind of talking about this with everyone, and also be mindful that there are any questions that come up or any insights or things like that that you have and you'd like to share. Please feel free to interject at any time. Just a few of my experiences I've shared. I think I started serving in the community very young, even though I didn't know it. Even at the age of 17, I joined the Marines, and I thought that was pretty cool. But more importantly, I learned that was about service at a level that I never thought about until recently. That being able to serve sets the catalyst for how you build community. And so, let me see here. There we go. Oh, sorry, I should have shared my screen. I apologize. This is thank you very much, Jimmy. I appreciate it. So I've worked with community organizations at the national level and also at the local level. I've worked with the Kresge Foundation, understanding racial equity and inclusion in the art space and what does that look like. We've held workshops and community meetings around perception of health, and I've worked with ASU in regards to the community advisory boards. And so I've been a part of a lot of different community-led organizations and community groups. I've also conducted some community health assessments, CHIPS, CHAWS, and the like. And I've worked in public health for about 10 years. And so a lot of the work in public health, as you already know, most of you know, is about how do we engage community. And so a lot of the work that I've been involved with over the last 10 years or so, it's really been about understanding different communities, both in the rural setting, the urban setting, communities of color, communities of disadvantage, and access to care communities. There's a lot of them, and I'm sure all of you play a role in one of them or another. And so I wanted to bring this experience to the presentation to share some of the things that I've learned and some of the things that I probably should have did better. And I can share that with everyone else here. So the objective of our goal is to capture these three things. We want to capture insight into the lessons learned around community engagement. What does it look like to weave community together in a way that matters? And so the world I live in around evaluation, we always ask the question, what does that look like? When we talk about success, when we talk about various modes of engagement or services, we always ask ourselves, what does success look like? And so in the frame of this presentation, I want to ask, what does community engagement look like if it were done successfully? And so that can be our marker for how we build out our process, right? Start with the end in mind and kind of work our way backwards. And so for me, I would like to share about really how do we frame success as community engagement? Then what do we do to work? How do we get to that point? And we'll also learn about the ELK model, if you will. It's spelled obviously differently, but it's an approach that I've seen and learned and kind of applied and built as we've built a lot of different projects. And then we'll also try to convene around the importance of community engagement. Why is it so important? What are the outcomes and benefits of actually doing it right? Who benefits from that? And then actually defining who is community. And so we'll talk about these three things throughout this presentation. And again, hopefully we'll get a chance to have a discussion around what that looks like. So a few moments of success, things that I consider to have been, I guess, executed well based on the objective of building effective communities. We'll talk about a few stories that I've been a part of in developing community engagement initiatives, and their success and why it was successful. Sometimes it's the things that you don't even think about that really drive community behavior. And so understanding what that looks like will be really, really important. And also it'll allow you to identify what gaps and what initiatives should be in place that maybe aren't. And again, in the work that we do, a lot of the times we don't have the resources or bandwidth. And so how do we leverage, layer, and collaborate? So that's where we'll talk about that. But changing perspectives improves program delivery. And I've seen this and a couple times, I'm sure we all have seen this. When you learn something new, you do something different. And Maya Angelou says you can't do better unless you know better. And oftentimes our community doesn't know. For years I worked for the city of Phoenix, and I was doing health education, and trying to. I was surprised by what the community didn't know. And oftentimes we have this expectation that people just know this stuff. Like we live it, right? And so we know this. We know that eating fruits and vegetables is important. We know that seeking mental care and mental health is important. We know these things, and so they become second nature to us. And so we engage a community where that isn't quite the norm. That is not common knowledge amongst everybody, and then a shared belief amongst everybody in that community. We often find ourselves, what is going on? And so I've learned to change that perspective. Assume that there's a level of ignorance, if you'll let me use that word, that the community just doesn't know. There's just access to information that they just don't know. And so in my years of doing that, I've found that even our basic information is oftentimes elusive. And so we come with a space of compassion. And what I've learned is that by changing people's perspective, once we learn something new, and we can identify how to do that better, and we provide those resources, I think it was really eye-opening to see how perspectives change program delivery. For example, we worked in Gila County on developing a tally review board. And the long story short, the data that was presented to the group identified that most of those folks that were suffering from opioid deaths were just normal people that just fell through the cracks. They didn't have this, or one thing slipped here and there. And one of the detectives said, wow, I never thought of these people as people. I thought they were just criminals. I just thought they were just out there to get high or to get whatever they were trying to get. I didn't see them as people. And that perspective change allowed for collaboration with the county and the first responders to provide more naloxone to those communities. And so by changing someone's perception of who these people are, we were able to improve naloxone distribution in that community, just because people thought of these situations as something as we can all fall into. And that's very much true depending on a lot of different factors. And so being able to change that perspective can have some huge benefits in program delivery. Another thing is also being vulnerable when engaging. It builds trust. That's a hard thing for a lot of us because we are professionals, right? We set this expectation to be the experts in the community when we go into the community, and so we have to. There's oftentimes this unwillingness to be vulnerable and connect with our community members because that's not our job. Our job is to implement a program, a grant, provide a service, collect data. There's these empirical processes that we have to do and that we're prescribed to do. That vulnerability piece is something that takes intention, and it also builds trust. And so being able to tell your story in front of your community members and in front of your organizations that you work with, to build that level of community allows people to connect, because what we find, and we oftentimes see this, is that we're all people. All of us are a part of a community of some sort, whether where we live, where we work, how we identify. All of these things are communities in and of themselves. And so how do we understand community? Is by knowing that we are community ourselves. And that's the last point, is showing up for one another is the community. That's the point. When and how we show up for one another, how we show up for our clients, our neighbors, our community members, all these things require us to show up. And show up really means that we come with the intent to help, and we come with the intent to learn, as opposed to, oh, here's what you're going to do. And I think we've heard that millions of times before. And so these moments of success that I've learned and seen that you have to get out of your comfort zone. I was asked to be the Fit Santa one year in Gila County, and being in rural Arizona and being in a jumpsuit that's like skin tight, and it's red and it's uncomfortable. That's not exactly what I was, what I'm here to do for community education, but I did it. I put on the beard and I did all of it. And it was one of the most amazing experiences. It was hot, and the kids loved it, but at the same time, they saw me because I showed up. It wasn't something I was required to do. I probably didn't do a great job of pulling off Santa. That's just being honest. And so that's okay, but I show up, and there was a vulnerable space for me because I'd never done it before, but the community appreciated that, you're willing to do what it takes to show up and show that they matter, as opposed to, hey, here's this program I want to provide to you. Do you have time to implement this? And let's get you ready to do this. And so that showing up really helped establish that level of engagement. And so that was really helpful for me. What I learned over the last few years, and especially the last 3 years, is that respect looks different person to person, but it always feels the same. When you feel respected, and the community knows when someone is coming with the intent to respectfully build some type of a collaboration or initiative to really support the work that's being done. And so how do we show respect? And I think that takes us asking what that looks like for our communities. What does it look like when you feel respected? And these are questions we don't often ask because it's not a part of our jobs. That's not how it's not part of our process. But at the same time, it's really important because that's how we build those relationships, is to understand what respect looks like for them and be okay with that's how this looks and show up for them in that way. And then the next one I've learned is intention is the greatest measure of success. It's directly commensurate with the level of success that you have. It's your level of intention. What are you trying to accomplish? And this is very objective focused, but what are you trying to accomplish? And then how do you get there? And how do you build the community or engage the community to build that with you? Because I think oftentimes we see that these programs are built in isolation and then implemented in the community with a harder level of assimilation. And that creates time delays, it creates missed opportunities. There's a litany of things that level of that lack of attention really can hurt a project, program, or initiative. And then also, I learned that organization and communication are the direct measure of intention, right? To the extent that you communicate your project or your processes, to the extent that you measure your outcomes and your objectives, to the extent that you're intentionally trying to create success within those community initiatives. And so this becomes the strategic plan that everyone operates off of. And so to the extent that has been done, to however small the project is or however great the project is, I believe is a direct measure of the level of intention or greatness and success that you'll meet. And I've seen this happen, again, in a few different ways, but intentionality is asking the questions that oftentimes are missed, and even sometimes going off script to ensure that the project goes according to plan. And so years of thank you, Jenny, years of understanding just myself and why I'm a part of the community and what I need to feel like I'm included in that process is for me, as well, as opposed to just being implemented to me, is remembering the ELK, if you will, as a rather silly slogan, but it's the acronym stands for engagement, learning, connection, community, and collaboration. And so when we talk about engagement, as an evaluator, the first thing we ask is, what is the evaluation question? How do we know that this thing is actually working? Are we doing our engagement work? And so what organizations and programs or community or faith-based organizations or groups does this community serve or serves this community? Do we know them? Do we know all of them? If we don't, this is an excellent way to start an asset map, if you will. What are the resources, assets that are impacting that community? For instance, when we worked with we worked with, this was years ago, we worked with the Orchard Community Project, which was down in South Phoenix. It was in a collaborative with CUSP, which is the community urban South Phoenix. I think it was Community Urbanization of South Phoenix. So it's been quite some time since that project. But what we did learn is that the faith-based organization in South Phoenix had more access to populations. And we went to, there was a project with ASU that layered on that, worked into the barbershops and started working with African-American men in heart disease. We also found that there were other programs at the park and Parks and Recs that was actually doing health education. And so we saw all these organizations that were serving the exact same people we were trying to serve. And so trying to coordinate that and looking at who is the point person, who are the trusted community members that this message needs to go to first. And so understanding those pieces gives you that structure that would allow you to then take it to the next step. And so as we develop our engagement strategy, who is our audience, who is our organization, and who touches that community in that regard. And from a business perspective, from a systems perspective, or a policy perspective, of who's engaged in that community and finding out how do we leverage that. Oftentimes using what's already in existence, whether there be a community group that's already meeting on a weekly or quarterly or monthly basis. Your leadership programs, for instance, I'm involved with Gilbert Leadership, and they do a lot of work around community connection. And so how do we leverage those Chamber of Commerce organizations that are doing that community outreach programs and initiatives and activities? How do we get that professional skill set into our programs and into our communities? And so there's a lot of opportunities for us to look at that as this exhaustive list as a way of mapping out what to do next. And so this evaluative question for me helps me to understand, what don't I know? And so this will give me a chance to say, okay, well, let me see what other organizations may be involved with this, or who's leading programs that are doing this work as well. Oftentimes, we see there's a lot of layering on programs and duplication as well. So I think that by understanding this, it'll give us a better roadmap into how to engage. And so our next one, well, learning, is really the evaluative question here really focuses on what are the emergent needs based on community membership groups. And so who are we trying to engage, and what are some of those emergent needs? And I found this to be interesting when for one experience that we had looking at local wellness policies at the state level, and even at the district level, the emergent need of the community was completely different than what we were fitted to do. Right. So if anyone's familiar with the School Health Index or the SHI or any of those type of school related projects, we go into these schools and say, hey, here's what the health of your school should look like. This is what you need to focus on to improve X, Y, Z around attendance, things like that. And we sound so smug, right? Because we know everything and we're the Department of Ed. It didn't work by a long shot, but we missed that one by a mile. What we found, what the emergent need was, they needed places to do their clothing and wash clothes. They had no access to washing clothes, and we saw attendance drop during the week because their clothes it was something so simple. But yet, because we had this understanding of what health should look like, what the approach we have and what we're funded to do, we came in with our own land. And so when we were able to kind of take a step back and see what those larger social issues were, we found out that there was a greater need for developing at the school, I think at the time, use some of their dollars in space to create like a laundromat. And so they were to put washing machines in the school and give access to the kids and the parents on the weekends, and attendance got better. And so but if we would have asked first, like, right, if we would have just said, hey, what are some of these challenges? We see this as an issue. What are you really facing? What are some of those emergent needs? And if we would have just asked more than just the school, or if we would have asked the PTA, or if we would have asked other organizations what those emergent needs are for the community, we probably would have found that out and saved ourselves quite a bit of time and money. But always ask those questions. And I think that who we ask is just as important as the questions we ask. And so being able to understand, again, from the engagement piece, who are we trying to engage? And then what are those questions we want to provide them with? So just some structure that has been really helpful, because I've learned, unfortunately, that you don't, you can call it, it doesn't move the process, and the community becomes disengaged, and they feel that there's no true connection to what you're trying to do. They need help with this, and you're trying to push this on them, and it becomes this disconnect, and then you start turning people off. Because then no one's like, you're not listening to me. I need help with washer and dryer. You're trying to give me a playground. That's we're running in parallel, so we'll never connect. And so connection, I like that was a great segue. Good job. I didn't plan that one. But the research question or the evaluation question says, well, what do we both want to address? Right now that we understand what the emergent needs are, here's what we have in one hand. Here's what we've been structured to implement and to address. Here's what you actually need. If they are different, what do we both want to address? And I've gotten into trouble a little bit in times past asking that question, because it is oftentimes different than what we've been funded to implement. And I've been asked not to go that route because it creates discouragement within the community, because they know that once you say, well, I can't do that, but we can do this, it becomes like saying, well, I can't get you a pony, but I can get you a stuffed animal. It's not even commensurate. It's not close to what the needs are. So being able to identify what that is, and even if you can't, that question is so valuable for future funding, right? Because if you can't address that now, at least you know that this community really needs this. And so who can we partner with? What are those organizations, or what are those resources? Are there funding opportunities for our communities to address what they're looking for too? Because then at that point, you become an asset to that community member. And that's, again, building that trust, being vulnerable. Could you imagine writing a grant for something that you don't even get paid for, so that way they can do the things that they want to do? I mean, it's happened, and it happened. But are we willing to do that to build that level of trust in the community, so that way on the back end of this, we can get those benefits that really drive community change? And then creation. What are we going to create together? So as we look at the emergent needs, here's what we have. Here's what I've learned from you. Here's how we've engaged, and this is our engagement strategy with the organizations that are involved. How involved is the evaluation question? Is our population with the design, structure, and implementation of our service or programs? For all of us public health people, that's the community-based participatory research model, CPBR, I believe it was. And so oftentimes this is hard, right? How do you get the community members involved in the design of it? That often has so many different layers to it, right? It depends on when you get funding. It depends on when the RFP clears, and then you have to. There's so many different layers, but ensuring that the community is a part of that process of, here's what we're trying to do. And I've seen this happen, and multiple times it's continuing to keep the community partners involved through the process. We've applied for the grant. We're waiting for funding. Here's what's next. And being able to provide that timeline to our community members, so they see not only when it's been applied for, they can see what the background. They want to know that it's being worked on. So there's not every day, you're not in the community every week, every month, but there's stuff happening. And so can we provide the community with that level of communication, right? It goes back to our original point. Communication is the direct corollary to our level of intention and our measure of success. And so can we communicate the timeline of what this project looks like in its entirety with our community members, and say, here's where we're at, here's our struggles, here's where we're running into these issues, being able to keep them a part of the process. Once we've received the funding and the structure, is now we need to be able to structure, what do we do there? How are they a part of that process? And it's, again, far more labor intensive. I understand that with certainty, but it's so important. Like if done right, this can create not only what you're looking for, but it creates these relationships that build in perpetuity. You can rely on community members. Imagine having a community advisory board of just community members that has been together for 3 to 5 years. And so, and these, as they move, and as more community members come in, this symbiotic or this organic process kind of grows with the community and with your programs. And so these are the intentions, because having access to the community creates not only the data points that you need, but also moves the needle in so many different ways, and also gives you access to stimulation and resources and information that you probably wouldn't get any other way. And so how do we create our community in mind, bringing them along with us for the ride, sharing the timelines, sharing with them what we're doing. Again, some of these things we can't do, but I think that how we share and how we communicate what's happening, even when we're not engaged with them, shows that we care, and that's just as important as providing them with the services and the resources, probably more so. And so then once we know what we're going to create, we understand who's who and what's what. We understand what the emergent needs are. We understand what we've been funded. We understand what are the next steps. Now we go to the final part, and that's the collaboration. How do we work together and build this? Now, this is the process that takes the most time, because this is the actual implementation of whatever project or program that we're trying to implement in the community. How will this collaboration work, and how equitably reflective is the plan? And so the term equitably reflective means that, again, are we meeting the needs of both the community as they've defined it and our program? Is it equitably reflective of the plan that we put together? So in looking at that, the community should be able to be just as involved and participatory in how that looks, understanding what the plans are, some of the barriers, and again, being able to support and help, because you just don't know what the community is willing to do if you don't engage them to do it. And we've seen some miraculous things. I'm sure that all of you have got stories about what you've seen the community come together and do just by simple intention and planning. And so this ELK model, if you will, this approach to engagement, learning, connection, collaboration, excuse me, I'm drawing a blank, but this model allows us to ask questions. And if we don't know the answer to them, that's just as effective and just as powerful as if we do, because then we know what our next steps are. If we're looking at it, intentionally creating sustainable community models that provide us with what's the most beneficial piece. And we'll talk about that in a second. Oh, went the wrong way. So the importance, why do we want to engage the community? Why is there so many dollars and resources and programs being put into engaging community? Because we are the community. Right? Every single one of us benefits from services, systems, and programs that the community is built around. And so what we can do effectively, these are some rather objective things that we can address or identify disruptive or unhelpful systems and policies to solutions. When community members ask for certain needs, we identify, that can be done because of either policy or there's programs, there's just a lack of resources to do so. And so we identify what's not there based on engaging the community. We also find out, that there are gaps in services and delivery models of care, right? We oftentimes see this, and I can say with a level of certainty that we have so many programs out there, but even just transportation, getting to our programs is a challenge. So even if the programs are there, if we have the resources, there's all these barriers. And so understanding what those gaps are, to housing, service to transportation and the like, these are all these larger layered social determinants of health factors that really drive whether our program is successful. And we need to identify those things if we haven't already. Another thing that's really important that is prioritizing resources and funding opportunities. This one will be really effective in regards to understanding, hey, we have $1,000, we need to be able to do this. But in that same perspective, as the lived experience provides us with insight, as the experts, as the community experts, it's important for us to understand our role in that. And we provide the actual data and the actual infrastructure and knowledge and the planning and the follow-through and coordination that really drives these things to be successful. I think that's been so important, being able to create the structures and processes so that way everyone can follow along and build effective communication strategies. And lastly, we can create informed and engaged community members, which I think that if nothing else, if we do nothing else, but that last point, there is just so much to be gained from that. I mean, we talk about an engaged community of those who participate, those who share resources. And it's being able to get folks to programs that need it and have their family members refer them. Hey, this is a program that you need to be aware of and involved with. And so these are really, really powerful things that the community brings to us. And it's the community that makes these services grow and go in the first place. And so how we create the engagement strategy for them is so effective. It's useful and important. So these are just a few things that I've seen, and I think they were really effective in regards to understanding the importance of community engagement. And so before we conclude in its entirety, I wanted to reach out to my community here that we have here on Zoom and understand, as we look at community engagement, are there any other factors or important factors that that you feel that are left out, or are there any questions that you may have in regards to strategy or the information that you've just recently seen? Excellent, excellent. Hearing nothing, that's fine. I have my communication information there, my email. I'll have these slides sent out to everyone at the end of today if there's any questions, or Jenny probably could get them out to them sooner. But I wanted to open up the floor if there's any other questions. But just wanted to say thank you very much for your time, and hopefully there was some useful information being shared this morning. So thank you.
Thank you. I think that was a lot of great information. So I think a lot of us are still processing questions. So if there's anything that somebody wants to add in the chat, or if you want to come off mute as you're thinking of your questions, feel free to do so.
Hi, this is Susanna. I have a question, Mr. Gillette. In your experience in doing community engagement with various groups, was there some kind of a timeline that you saw was pretty common with, or was it really varied? Did you have some experiences where it was just kind of a short, quick turnaround, or do you find that most of them took a long time, months, years?
That's a great question. It depends on the project. I was involved with a COVID response that we had to get like $70,000 out to the community in like 3 weeks, and so we had to build this community consortium of philanthropists and all these other folks to say, hey, here's how we're going to get these dollars out. And so we had 3 weeks of a turnaround time, and it was, organization is so critical. So what I've developed is a strategic narrative kind of template. And so whenever we're going to a community project, this template allows for us to get to the meat of what we're trying to get to. We're trying to get to the point of, hey, here's what we're trying to do, why we're trying to do it. And it just, organization and having an agenda is critical, because oftentimes conversations lag, and depending on how fast or how much time you have to move, the organization of how to engage the community and what you're trying to accomplish, and making sure that's very clear from the very beginning is very, very important. It does take time depending on the community, but it depends on what you're trying to accomplish. That, I think the timeline of what you're trying to accomplish then trumps what the community timeline is, because we have to get things out in a certain time. And so having a plan, like an agenda, a timeline, a strategy, some type of a strategic narrative that kind of frames the objective of what you're trying to accomplish, to give people a chance to participate in a structured way, allows for communication to move a lot faster. So then you can vary that tempo depending on how fast you have to move. So that's been my experience. It just, as long as you come to the table prepared for the conversation and what you're trying to accomplish, I think that you'll mitigate as much delays as possible. That's not to say that you won't have many. You'll probably have several, but at least you'll mitigate the ones that you can. I hope that answered the question.
Yes, thank you.
Excellent. Well, with that, I just, again, thank you so much for giving me the chance to speak with all of you this morning, and I hope to connect with all of you eventually down the road, and best of luck to you and your work. And again, just thank you. I really appreciate it.
Thank you. We are very happy to have you again join us today, and look forward to reaching out to you and collaborating with you more in the future.
Excellent. That's awesome. Thank you. Appreciate it.
Hey, Jenny, do I have time to ask a question?
Jason, are you still here with us?
I am, yes.
So this might be Jason or anybody, I guess, is I just was thinking about this as we're talking about, experiences with community engagement and where we're going. And I feel like maybe it's just because we're like, just kind of starting this whole process. And I mean, we've talked to community a lot, but it feels like we're doing a lot of this, like, we're talking to community about specific projects, right? Like, hey, we're in this community. What is it you want to work on? Gardens or something. But how do we get to the point where we built the capacity for the community to just be part of the process? It's part of the system. It's part of the everyday thing, so that we're not, I guess it's kind of like, because I think about, like, we're in Maricopa County. It's a gigantic county. If we just continue to work on small little projects with communities, we're never gonna like impact the whole community, the whole county. And I feel like we're just kind of like little spots here and there. And I really want to see the bigger picture of, like, how does this just become like a norm, and what can we do to get to that point where there's bigger things going on rather than us walking alongside one particular community. Am I making any sense?
Yes.
Okay.
Yes. So it depends. I think that, and I'd love to get some perspective from the group in here, but what I do know is when you're trying to do the larger projects, it's an iterative process, and I find that success is both iterative and cumulative. So it's layering these successes on one another. So you start with one community project, or like, for instance, community gardens, and so who touches that project? And so I think that from an evaluative lens, you say, well, we have the community that touches the community gardens. We have potential grocers that can touch the community gardens. So you have all these organizations that can touch them, and then you involve those organizations into the fold. Chamber of Commerce could be a really good, and so it's layering those things on. So then, if you have the community garden project, what else is happening in the community already that's existing, that's been doing really well, that can be a collaborative, even if it's just information sharing. So I've been to Chamber of Commerce presentations just to share, hey, this is what's going on in the community. And so it's almost going on tour, right? And so once you have your project going on tour in the community, and whatever organizations that are established and up and running, present and share what you're doing with them. And that way you share the information, and then you'll probably pull one person from that organization to be a part of it. And then you go to the next one. And so you start pulling folks from other organizations to be a part of this, and it starts to layer on one another. And so you can start seeing that, for instance, this community garden project and another community project, they start sharing meeting spaces, or they start working together on collaborative initiatives. So it really is like, if you can find a way to layer these initiatives on, even if it's not something that directly aligns, it can be information sharing, it can be an opportunity for you to get a recruit for more members, it's one of those things where I find the most success is layering that on top of one another, so that way you can build momentum without having to change your message to cater to different populations. You say, this is what we're doing, and we're sharing that information and you'll get, little by little, you'll get iterative and incremental participation from other organizations.
Thanks, Jason.
Great question. Thank you, Julie. I will share this really quick point. I did a presentation on ethnocentricity at a humanist church some years ago, and this is an initiative about community engagement. So I'm not a humanist, but they asked me to come out and speak, and I'm like, all right, let's talk about ethnocentricity. And so knowing your audience, and I think when we talked about our presentation, I did not know that this was going to be that I didn't know that some of the audience was there to just find out how to build their own community garden. So you go to this presentation. I went and just trying to find out exactly how to teach ethnocentricity in a way that everyone can kind of grasp it. But what they really wanted was a community garden. They wanted something they can build and have for themselves. And I would have never known like that. How do you even know that's like they have nothing to do with one another? And so in doing so, then I connected them with an organization that starts finding ways to, how do you build community gardens? So they're I think last time I checked, they're actually building one on their campus. And so be willing to engage, be willing to go and just have the conversation with folks. You never know what they're really trying to accomplish. And at the end of the day, people are really trying to create communities, especially now after COVID. There's a lot more emphasis on community development and community building. So it's really important that we show up, and even when we do, we might not figure out what we're trying to be there for, but it'll be clear once we get there, and the people will kind of share that insight with you. Ta-da! No, okay, that's all. That's all I have. Is Jenny? Do you want me to sign off or dance, or I don't know?
It is up to you. We are a little early, so we can head back to the main room. Thank you everyone for your time, and thank you again, Jason. You can log off, or if you want to hang out with us, you can.
Absolutely, I'm sticking around for a little bit. Thank you so much, everyone.
Thank you.